Public Safety Committee meeting to order for May. Probation first, please. Mr. Graziano.
Good evening.
Good evening, sir.
I'm here to request to fill a vacant budgeted probation officer position, with the probation assistant taking that position, that position will remain vacant.
Move it. Second.
Second.
All in favor?
Aye.
Opposed? So carried.
Thank you.
Thank you.
See how that goes, Nick?
District Attorney? Can you just introduce yourself if you?
Yes, my name is Nicholas Rolfing. I'm the Deputy District Attorney in Columbia County, starting in January.
Welcome.
Some places I recognize. Nice to see you all.
You don't recognize her, then you haven't been here.
Of course.
I haven't been anywhere in this county. So the District Attorney's Office has a request to authorize to enter a contractual agreement with Repeat Business Systems for 2 leased copiers.
I'll move it.
Second.
Second.
All in favor?
Aye.
Opposed? So carried.
Rob throws everybody off by saying.
thought he
second.
Question mark at the end of that.
Yeah.
Secondly, the District Attorney's Office seeks to authorize an increase in revenue, the revenue line, District Attorney Criminal Justice Discovery Reform by $60,000 to form the ADA discovery stipends for the remaining part of 2024. And furthermore, the New York State Department of Criminal Justice Services has approved a grant in the amount of $219,105, and we are seeking permission to accept those grant.
Move it. Second. All in favor?
Aye.
Opposed? So carried.
Thank you very much.
Thank you.
Thank you.
Sheriff.
I'm sure Grant, I was surprised Grant didn't jump out.
He was a little hesitant.
Well, Grant was at the end. That's why.
I'll give you a shot here.
Nick, you don't.
Move it.
Second. All right. Authorize to fill vacant full-time corporal's position in the jail, salary 69,300 and backfill.
Second. Do the first one, actually. I'm sorry. We went a little too quick. So authorize the sheriff's office to fill a full-time corrections officer. Who was the
Matt.
Matt, and second was
Right.
all in favor?
Aye.
Opposed? Carried.
Thank you.
All right. Now,
Authorize to purchase a tilting skillet.
no, do the second one, the corporal again,
Oh, okay.
please.
Second is, to authorize to fill a vacated budgeted full-time corporal correction officer position.
Second, all in favor?
Aye.
Opposed? So carried.
We already had a move in a
All right,
second.
go ahead.
All right, onto the tilting skillet braising pan for the Columbia County Jail. Authorize us to purchase that in the amount of $18,175. The other one's from 1989, so it's pretty shallow.
I'll move it. Second.
All in favor?
Aye.
Opposed? So carried.
Last little wording, to authorize Schuyler County Sheriff's Office and the County of Schuyler, reasonably anticipates regular recurring emergency situations throughout the summer season due to crowd control. This is all based on Watkins Glen. This is just to provide personnel, vehicle, equipment in the event that they have an emergency declared in the county.
Move it. Second.
All in favor?
Aye.
Opposed? So carried.
Is there something big at Watkins Glen this year?
They're kind of doing all their concert series and everything else again. So it's much like we did in Hunter with Greene County. We don't anticipate being up there, but if they do declare an emergency, boosters fall down, or it's a mass casualty event. The last is to authorize GTEL, formerly known as Viapath Technologies, to provide telephone services and IP-enabled tablets to the incarcerated individuals of Columbia County, and whereas authorized to enter into a data exchange amendum to master services agreement, which allows the exchange of data between other law enforcement agencies.
What is the data that's being exchanged?
It could be a plethora of different things. So it could be based on an investigation, phone numbers, contacts. This would all be based on an investigation through corrections law. So they would have to request the information and they would share.
Who would Is local, like GTEL's requesting it, or?
This is, an information agreement, so when any incarcerated individual gets a tablet, there's a user agreement, which they either accept or deny. If they deny it, there's certain things that aren't accessible, that are blocked out. So this is capturing some data. Obviously, it's not watching if they're doing credited, well, I suppose it could as well, credited courses on their tablets. That could be shared, but I don't know why a law enforcement agency would want that. But mainly it's going to be information such as contact information on who their phone numbers, email addresses, so on and so forth.
So they're making phone calls with the tablets, and then
Okay.
you're getting information from GTEL, or you could get information from GTEL based on who they called or who they contacted.
Yeah, it'd be no different if they made a phone call from the jail phone. So it's basically the same thing. It's just now utilizing that capacity of the tablet.
Correct.
I'll move it.
Second.
All in favor?
Aye.
Opposed? So carried.
Thank you. Out of county inmate report, should be a appropriate individual report. I apologize, it hasn't been changed yet. Dutchess County, $3,150. Franklin County, $9,180. Greene County, $5,700. For March total of $18,030. Year-end date, $52,275. Last year's date to this date was $187,925. That was based on Dutchess County's remodeling of the facility. And then self-explanatory, we had this last session, security services statistics. I don't know if you want me to go through the numbers, but it's all provided there. It just tells you the amount of people. The MAG count is the number of people through the door. Contraband is the amount of contraband that was prevented from coming into each facility. Arrests, self-explanatory, and incidents. Each building has listed the amount of incidents that occurred in that building. It could be anything from a lost wallet to an assault.
A little easier to read this time for the red.
Yeah.
We made a change based on.
Yeah. Reggie was great.
I didn't even know they were up there. until you said
Any
that.
questions for the sheriff?
Great, I mean, of the MBU.
Any questions?
Did we anticipate the revenue for the inmates this year?
Yeah, we absolutely did, because last year we had quite a few coming in from Dutchess County who were boarding. So we knew that this year was going to be greatly reduced based on the fact that we didn't have those incarcerated coming in. There are some other counties now that are seeing some difficulties. And unfortunately, right now, it's slipping my mind which county they're talking about closing one of their facilities because they have 2 jails in their area. But it's a lengthy travel. We probably won't be able to work with those individuals because there's a lot of counties between us and them. I don't take Burlington, but I'm not 100% sure, but I can get you information.
That would make sense. That's fine. So we anticipate. Is there a fixed rate that you charge per day for inmates, and what would that be?
There is, it depends if it's a juvenile or not, but that rate could be anywhere between 70 and 90, depending on, I think, Greene County, we have an agreement with $70 for their incarcerated household and female population. So it fluctuates between those two.
So I mean, it would be possible to see the total numbers as well, instead of, in addition to the revenue that's generated, the number of incarcerated people from other jurisdictions that you're housing.
Correct, and I probably can pull it up on my phone right now, or.
You know, to do that right now, but I'll be in touch because I would have.
Absolutely.
Okay, thanks.
All set?
Thank you.
Thank you.
Thanks, Sheriff.
Thank you all.
Emergency management?
Good afternoon.
How are you?
No resolution requests. Our activity report. And also over the last month, we had a very good tabletop exercise that we've been planning, organizing for a few months now. There were 60 people that attended. They represented 24 agencies. It went very well. It was 4 hours. And also, we've been in a study group. It's a program by the Army Corps of Engineers, DISHES, and BEMA. And this is something they've done like every 10 years since the 70s. For the first time, they've opened it up to Hudson River tidal counties, so up to the Lock and Troy, to see if there's a need for evacuation zones like they have on the coastal areas. And it has to do with the potential for tidal surge during a hurricane. We're far enough up where it doesn't look like we need those, because by the time it reaches us, it's typically downgraded to a tropical storm, which is still significant, but and then the tidal surge really hasn't been an issue. But we're going to continue with the process just to get information on the case we ever do have to come up with any. They bring a lot of good information. I did send some notice out to the towns and municipalities along the river. We really have never had to evacuate anyone, even in the city of Hudson, due to flooding by the river. Our issue is usually with a lot of rain, which the creeks swell up, they go into the river rises, and the creeks back up inland. So anyway, it doesn't look like we're going to need them, but it's a good process to go through. It's been a lot of good information, so we're going to continue with it. And in the future, if we feel we ever need those, and we'll know how to do them. So.
Terrific. Can I see you after the meeting, please?
Yes, sir.
Thank you, sir.
Any questions? Thank you.
Thank you.
Thanks.
Public defender's not here, but my understanding the chairman's gonna present this.
Yeah, they're just requesting permission to move the full-time, one full-time assistant public defender currently covered under Earl Herring to a first assistant public defender position that was reclassified to full-time in resolution 94, 2024. So we've already done it. This is still funded by Earl Herring. It's just a change of title. He'd like to move it.
Second.
All in favor?
Aye.
Opposed? So carried. Any questions? Any questions from the public? Any questions from the supervisors? I just want to inform everyone that Supervisor Hoagland and myself met with the Police Reform Committee, and there's some clerical changes. It was actually a very good meeting, and we're there in review right now with Elena. We're gonna meet back with them again just to finalize it, then we'll hand off everything to them. So it was very productive. Anything else?
I'm not sure the phone we have.
Oh, George, yeah, we had a question from Supervisor Hoagland about the phone up in New Lebanon, and I explained that you had reached out twice and there was no response, if I recall, that was correct. So I'm not,
It's been, they were paid, they were invoiced, paid, they sent us an invoice, we paid them.
so she said that they were not paid to dispose, but paid to purchase.
To replace, they didn't ask for any disposal.
I'm just giving you a heads up. I'm not
I guess
getting,
they still have phone.
I think they still have,
She's gonna reach out.
she's gonna reach out to you, just giving you a heads up.
Yeah. Okay.
Anything else? Motion to adjourn?
So move.
Second? Second. All in favor? Aye. Opposed? So carried.
This could be a record.
All right, everyone. Thank you for coming out on this beautiful, late spring afternoon. It's 3:45 p.m. I'm going to call this Health and Human Services Committee meeting to order. We're going to start with Department of Health. Director?
Hello, everybody. A couple of resolutions today. Requesting authorization to contract with an agency evaluations and services for preschoolers.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Requesting authorization to fill one healthy neighborhood specialist position.
Move it.
Second.
Further discussion? All in favor? Opposed? Carried.
And then requesting authorization to transfer funds and award grant funding for workforce strengthening and retention to eligible department employees.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Okay, and then we're into our April report.
Did I have an extra emergency fill here?
Oh,
Oh.
they're looking for an emergency.
Oh, I should have mentioned that. I'm sorry about that. Is that, Healthy Neighborhood Specialist is an emergency?
Is the emergency bill, I'm sorry.
Yes. Thank you, sorry about that. So 424 total communicable disease investigations in April. Of the samples, we had 1 Campylobacter, 1 Giardia, 1 dengue fever that was travel related, 1 E. coli Shiga toxin travel related, and 1 typhoid fever that was travel related. So exciting month there. Thank you. 2 cases of COVID at a long-term care facility and a rule out of varicella cluster in 2 families that were just rashes. But the PCRs did come back negative, but that was a full investigation there too. We only had 17 cases of COVID in April.
We like that.
We like that. And 0 deaths, we like that even more. Hospitalizations have been very low. We still continue to monitor wastewater. We had 1 rule out of active TB in April. We provided vouchers for medications to 2 individuals. We had several vouchers provided for quantiferin gold testing and then 1 X-ray. I will mention that of those 8 quantiferin gold, 7 of them did have insurance. So that the voucher in those instances really act as an order. It's not a fiscal, fiscal measurement. It's just in order to get to them where they need to go as soon as possible. We have 209 cases of Lyme to date, 12 anaplasma. No rabies submissions in April. We provided post-exposure to 2 people. We had our rabies clinic for 73 dogs and 20 cats that were vaccinated in Ghent. We will be continuing to do our clinics as drive-through events, and the remainder will be in that location in Ghent.
We should
3
do
more
a
in the year.
combined one in the fall for like COVID for the drivers. rabies for the-
It's not a bad idea.
Double tap.
We'll take it back. 21 environmental health inspections in April. Nothing remarkable to report there. 104 vaccines provided to 50 patients. Only 1 COVID vaccine. I'll just remind you that we are only doing children 11 and under. Adults, we do have to send to the pharmacy because we just weren't getting calls, and this time of year is light on that kind of thing anyway.
So remind me when the new vaccine will be out, the next generation of vaccine.
Likely in the fall.
Okay.
And it's unlikely that it will be a combined flu COVID. I think we're gonna have to wait another year for that, from what we're hearing at the federal level.
If they did combine it, could you separate? Could you just get a flu? Could you just get a COVID?
Oh, sure. Yeah, that would still be an option, I'm sure, just because of how it's used.
Yeah.
Our migrant program hosted our annual migrant health fair at St. Joseph Church in Saxon Falls. We had 92 people in attendance, many families. We had our immunization staff there. We had our health education staff and also early intervention. Speaking with the public, we had partner agencies there too. Actually, the Cancer Services Program came down and they provided 11 vouchers for full mammograms and then 3 vouchers for colonoscopy. So that was an incredibly successful event for them. And then we also trained one of our migrant health caseworkers in it as a child passenger safety technician. So they'll be able to provide that service to our migrant population as well. In preschool and early intervention, we have some good news. They have pushed back the rollout of the EI Hub that I've spoke about here several times back to October, which will be much better on a number of levels. Most importantly, our children change over from EI to preschool in August, and putting them in the system now and they'll be changed over, that didn't make any sense. So that's just one thing that we'll avoid that way, and hopefully the state will hear some of our complaints on the current system and make appropriate changes in the meantime. We're hopeful. We do have our new director who has started in March, and we throw right into annual reviews. So every child in our program gets an IEP review. So she's been very busy. And then, provider increase, an update there, so 5% across the entire budget, but an additional 4% for rural providers. That sounds pretty good. We're unsure if that will be good enough to encourage certain providers to stay in the program. We also have learned that the rural designation will be by zip code, so it's unlikely that every zip code that we have will fall in that designation. So that will kind of be something that we'll have to navigate as we get there too.
When will we have a list of zip codes?
Good question. Hopefully before October. So that's there. And then preparedness. So in April, we hosted a measles tabletop exercise. So forgive me if I'm over-explaining, but a tabletop exercise is when many agencies or many different organizations or representations come to a table and we talk through a scenario. So we did this internally. We had our immunization, our communicable disease, our emergency preparedness, our environmental staff, and we worked through a scenario in which we had a positive measles case at one of our children's camps, because that seems like, with measles cases in New York City and downstate, it seems like the way that it would happen to us would probably be through a children's camp. So we brought us all together and we talked through how we would navigate that situation, including when we would start to incorporate external partners and when and where and how we would ask for help, and then when and where and how we would push out certain messages to the public. So certain things have come out of that conversation. I think one of the things that we are likely to do is to offer preseason clinics directed towards staff at these camps, because most camps have school children who are required to have certain vaccines to attend school. Some camps don't. Some camps get staff from out of country. So we're just kind of talking through how we would.
I think those 3 outbreaks we had were all staff that was from out of country, right? At the southern part of the county.
Yeah, like I said, it'd be nice to get a hold of them before they
Yes.
Yeah.
Yeah.
to take it.
Yes. I don't know that we have the organization on the side of the agency that provides those people to the camps to make that happen, but we are kind of exploring that avenue as well.
I know one of the things we talked about was having the camps require that their counselors be vaccinated.
And
did we make any headway on that?
So we haven't, but many have opted towards those kinds of things. It's just because, that if something happens, they've got to shut down. That hurts their pocket, right? I mean, so that's the argument that we always make. But when they're looking for people and they're coming from out of country, it adds a level of disorganization to it that doesn't always work out well, or as well as we'd like. So
It's always cheaper on the front end.
yeah, exactly. So we're gonna explore doing that there. We also participated in a tabletop at CMH, and then an Amtrak tabletop as well. Public health education, 7 outreaches reaching 532 people, up to 548 sharps collected from the public year to date. And then the health educators were essential to creating the annual report, which we'll talk about next. We had 1 antepartum and 1 newborn referral in April, and then 2 cases of hearing impaired children entered into the physically handicapped children's program. Any questions on that one?
Great.
Okay, thank you. And then next we have our annual report, which we have made some changes. You can see it. Oh gosh, scroll back. So I've got a printed copy here if anyone would like to see it too. Kelly has it up on the screen as well. We made some changes. This is a document that has been probably upwards of 60 pages for the last 50 to 75 years. So we've made it a little bit shorter and more concise.
I would recommend that we hold it over for a month to give us time to review it.
Sure.
And if we have questions up next month.
Sounds good.
But I like how clearly it communicates. Yeah.
Yeah.
And Mungo likes pictures, so that's.
Pictures are important. Any other questions for me? Oh, yeah, so sorry. Yeah.
Well, this is actually your appointment.
Yeah, it's a resolution to reappoint David Harrison to the Board of Health. He's been a member, his term expired or is expiring, so we'd like to reappoint him.
I'll move it. Second.
Further discussion? Director Harrison, great component of the VAP board.
Absolutely
I can say that
essential.
personally.
Yep.
All in favor?
Aye.
Opposed? Terrific. Very.
Thank you very much.
Okay, up next, we have Office of the Aging.
Welcome.
So first up, I have a resolution to contract with Stuyvesant Falls Memorial VFW to utilize their grounds for our annual senior day event, which will be September 12th.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you.
It's a lovely venue.
More details to come. Next, we've got some anticipated community engagement and education events. So these are kind of in the works, but nothing really nailed down yet. A lot of these are kind of rolling over from last month's update for you. Still working on trying to get something together for Hudson Pride. I've reached out to Big Gay Hudson Valley and Out Hudson are the two organizations that we've done outreach to so far. Hudson Flag Day Parade, I was all set to move forward with having one of our transportation buses as our float, if you will. I had a resounding probably 75% yeses from my staff, which I wasn't really expecting because usually they're like, all right, I need to come to. So I was really pumped for it, but both of our buses are on the fritz right now. So I'm waiting to hear back from the garage to see if they will be safe to use as a float. So that's pending. Senior Day in September, we're working on planning that, kind of nailing down all of the vendors and getting tents and things like that. Senior activity days. So this, I'm looking for a little bit of input on from you all. I know we had talked about going around to do information at each of the town halls. I was thinking of either with that or separately, this is where I want the input, doing some type of senior activity component. So whether it be a senior game day, I was thinking night sounds more, better, more common, but probably for seniors more during the day. Senior game day or senior movie day, something like that. Do you think that that would be interesting to pull people from the communities into these info sessions? Or should we just stick to plain old us talking about services?
Free food.
How about both?
Yeah.
We do both for our senior lunches and it always draws a much bigger crowd. But I think it would also draw from the larger community if it were advertised.
All right.
But people love movies. And games.
Perfect.
Now we can never get them out.
When's the Flag Day Parade?
June
June
8th.
It's a Saturday.
All right, that's helpful to know. Thank you. Still working with Columbia County Sheriff's Department and Hudson Police Department to try and plan some of those World Elder Abuse Awareness Day talks at each of the senior sites. That would be throughout the month of June, with the actual day being, I should know this off the top of my head. It's a Saturday. I want to say the second Saturday in June, but I don't remember the date off the top of my head. 16th? 15th sounds right. Also talking with the Hudson Fire Department about some fire prevention and cooking safety classes. That's still kind of in the works. Bingo size partnership with the health department is underway. Walk with Ease is kind of waiting until that piece is rolled out. So that's where we stand with those. Recent events, as in things that have happened since the last time I was here with you all. The VF Mother's Day Marketplace was a hit. I ended up giving away, well, I had Supervisor Adams give away
You gave it away. I put
a
your
Walker Squawker. Oh,
Yeah.
thank you. A Walker Squawker to a lucky Kingdon resident. And we had quite a few people stop over to the table. It was beautiful weather for it. National Volunteer Appreciation Week was April 22nd to the 26th.
much to the dismay of probably most of my staff members, we hand wrote about 200 cards for all of our volunteers because we wanted to do something to say thank you. I could tell you we will not be handwriting 200 cards next year, but we got it done this year.
Now you have it in
Is
the
that because you
database there, right?
photocopied them this year when you were
No.
doing
I should have. I
that?
really missed something there. That was mostly because I wanted to throw something together and I had about a week or so to pull it together. It was very painful to write that many.
But it was very appreciated. The volunteers loved it.
Good. That's what we were going for.
It was a hit.
And then today was NYSOFA's Older New Yorkers Day up in Albany, where we honored Pat and Eileen Malloy as the 2024 Senior Volunteers of the Year. I brought the little guide book, program, I don't know. If you want to take a peek at it, I threw a paperclip on there for you. I'm sure I will get a PDF version that I can share, but I literally drove it from the event, so that's all I've got for you right now. That was very sweet. Upcoming events, in just a couple days, a couple of our staff will be attending an elder law forum to learn more information about all sorts of things related to aging. And in June, we are officially on the list for the Bliss Towers Community Day, where we hopefully will give out a bunch more of those walker squawkers. And a walker squawker, if you are unaware, is simultaneously adorable and annoying. But that's the purpose, right? It is this tiny little blue bird, and it will sing the more that you walk. If you put it on, you attach it to your walker, and it'll sing the more that you walk. It has like fun songs. I'll bring one in for you sometime.
I think it would sing the less that he walks.
Well, you want it, if you're encouraging, you want to hear it sing.
Annoy you into those steps.
They-
Be able to select which way you want to
Yeah,
go.
they could probably edit it or update it a little bit for that kind of programming. The other thing is it's motion detector. So if you leave your walker over on the side and you go get up to walk across the room, it'll yell at you to remind you to go back and get your walker. So it's fun. Let's see, Memory Mixer in June. Michelle Cram, who is overseeing our whole respite program and absolutely crushing it, is partnering with the Eddie Alzheimer's Services for a fun day down by the river to support caregivers. We're hoping for at least about 20 people to come to that. And then farmers markets coupons should be rolling in any day now from the state. We've got that kind of scheduled out for when Teresa, our highness, will be distributing those. Still working on updates to the website. I have come up with 4 logo options. I wasn't sure, do I need the logo once we vote on it as an office? Do I need it approved by all of you?
Yep.
Okay. That's what I figured. So I will submit that next month. We've got 2 tied for first place, so we'll have to do some heavy discussion around that. This is all from your coming up with a sign. I'm like, everybody else has a cool logo. We're just using, no offense, county logo is great, but you know, I want it to have some OFA flair to it. So I'll have that for you next meeting. Senior community centers. We are in the very beginning talks of reopening the Philmont site. We're hoping for an early June date. We have some kind of reconfiguring we need to do over there to get that done, but it is on the horizon. And because of that, we're having a conversation about maybe cross-training all of the site managers so that if someone were to call out, or, you know, if, for example, the Hudson site one day closed down for voting or something, we could move people around. Everybody would be trained at each site. So we just think that's a good practice to have. So we're going to start kind of cross-training everybody there. Some general programming updates. I had a really great conversation with Greg Olson, who is the executive director at NYSOFA, New York State Office for the Aging, and Becky Prevey, who is executive director of Association on Aging, who were also at the Older New Yorkers Day today. Just kind of to introduce myself as a new director, and they have a bunch of potential initiatives and pilot programs that they think we may be a really good fit for. So I just wanted to give you a heads up. We may be coming to you with some potential exciting activities down the road. They are also sending us a bunch more of those squawker walkers and the animatronic dogs and cats, which are really, really good aids, specifically for people with dementias. as a companion tool. So once we get those in, I'll bring them to a meeting for you. Maybe not the squawker walker. But the dog and the cat are pretty cute. They're harmless. Everhome pilot. So we met with Everhome last week. I mean, this is kind of an ongoing, but just a general update there. We kind of are all on the same page where we're thinking maybe we start to pivot and kind of market towards caregivers rather than care receivers, because we think that's probably more what this tool could be used for. And specifically within the OFA kind of services, our respite program, which, you know, is growing rapidly and is going to continue to grow because it's a very, very necessary service. But with funding from the state and us only having 2 aides, there's only so much we can do there. So we're kind of working on updating policies and procedures there to maybe look at about a 6-month period where you would have in-home supports. And then about the 6-week to the end, when we're pulling those aides out, we would maybe start to integrate Everhome into it, where you would have support from the in-home aides and then support from our staff and the Everhome staff to really train on how to use this tool as supplementing what you will still get from our respite program, which won't have the in-home support, but you'll still have case management. We'll still be able to connect you to services, kind of answer questions. So there's a lot of potential there. A lot of meetings and a lot of notes are taking place. So I just wanted to give you an update there. More to come. And the last thing I have for you is just a reminder about the emergency heat extension. Eligible households can apply through August 30th, even though if you bring heat anywhere near me right now, we'll pass out.
Is it limited to heat? What about cooling? I'm thinking if we have another hot summer.
There's a separate program for cooling. And I can make a note to email that out to you.
Cheap.
I get it. I didn't know it was happening for a second, but I'm here. I got it. I spoke at about 70 miles per hour there. So if you have any questions.
I'm so happy that you're revisiting the marketing on Everhome, because
Yeah.
it makes me sad to have those funds sitting there.
Yeah, I think there's a lot of potential, and especially our respite program, which is just going to continue to grow. I think there's a lot that these two could do together. You know, we can't be there every day for years on years to assist in home for these people, but we can set them up for success with, you know, a tool that will kind of sort of take the place of in-home support. So I'm excited. It's a lot of work. I'm excited.
Terrific. Any questions for me?
Thank you very much.
Thank you very much. We really appreciate it.
Thank you.
Okay, next up, we have Commissioner Gibson, DSS.
Afternoon. You doing well, you?
Good. A number of requests. The first one, so we just finished our 30-day, I'll call it a pilot, but it's going to be an ongoing Mormon Center once Code Blue season starts back up. But we sort of got to do a 30-day run on it. And one of the partners in that project is Greater Hudson Promise Neighborhood. So we finally finished out the contract on that, and I submitted that earlier, just looking for approval on that.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you.
Is this the Green Street location?
It is,
Okay.
it is. Yeah, I'll get into that after the request, just a quick update.
Okay.
The second is to fill in full-time senior transportation aide position. The employee resigned, is going on. Got its
Second.
Further
And
discussion?
any backfills there.
Okay. All in favor?
Aye.
Opposed? Carried.
The next request is to enter into an agreement with Building Bridges Supervision for providing neutral third-party supervision for visitation, which is something we're always in short supply of.
Move it.
Do you have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. The next request is for a full-time social welfare examiner position. And any backfills created therefrom.
I'll move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. The next request is for a full-time caseworker position and any backfills created therefrom.
I'll move that.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And the last request is for a full-time child support specialist position and any backfills
I'll
created.
move that.
Do I have a second?
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. And just quickly on the monthly stats, I'm meeting with St. Catherine's, who are home funders, on Friday because I have an extensive waiting list just within my agency to get them onto the St. Catherine's list so that they can work on home funding. And then I discovered how much the Section 8 waiting list has grown through these last few months. So I need to take a closer look at that. So I'm probably going to be reporting out next month on some of the things that I find when I delve into this a little more. But as everybody on this committee knows, this housing stock is so small at this point that whatever is available basically is outpricing 3/4 of the people on my waiting list who could go out and find somewhere can't go out and find somewhere. So that's becoming very concerning. I'll report that out with stronger numbers next month. And I know this committee knows, and I know I'm on the county's.
Housing task.
Yeah, but it's almost like something's happening here.
We should talk to Chris, because we talked today about rental assistance program through, I can't remember if it was CDBH, whatever that one is, CD.
To supplement,
Yes.
yeah.
So we should talk to him as he formulates a plan to apply for grants.
Excellent, excellent. Yeah, I'm just reading around the country that these conglomerates are actually building rental houses everywhere.
Speculative.
We're too small. As economies of scale go, we're too small, but that's where the market is. So, just to give you an idea. So I wanted to say that to sort of supplement the numbers. Also, yeah, a very
Are those record numbers? I don't think I've
Record.
ever seen it at
Record.
149 before.
record for this, how warm it is.
For this time of year?
Record.
Mhm.
Yeah, waiting list is long and it's filled with folks ready to move on.
And 54 children. I mean, that's a lot of kids.
It's a record. So, yeah, the concern is absolutely there. On the upside, we had a really good month run over at the Mission, and I really look forward to next Cold Blue season. It offered so many things that simple placement in hotels just does not offer. And we got a lot of community participation in that. I have to say that we were getting referrals from law enforcement, and this isn't a bad thing, it's actually a good thing for people to go anywhere. It really, I think, strengthens the argument that to have something full-time, full year round, where at any point people go up and stay is actually going to end up being a money saver. Now, I can't run a full year pilot. I can only do a Cold Blue, but it's something for us to take a look at the end of the next Cold Blue season to see if in conjunction with some of these other steps that we've taken, for instance, having these workers attached to our MDT team, if it's just going to end up more of a money saver to look at something like that, then maybe we ought to do that. But again, that'll abide my report at the end as I close out the season. And finally, I can't mention names. We're not in an executive session, but one of our longtime high utilizers is back in jail, and that's where they prefer to be. because they don't think that they can get what they need anywhere else. Just take a moment.
I did have
to
a
watch
bad
all
food. Good time.
and this person understand that we can't meet their needs out there. The MDT got together on Friday, we were talking about this. The client basically said, no, yeah, I'm going back to jail. And he's got good relationships there. I don't want that. He will probably be a
Does he have to
trustee
commit a
there.
crime to rejoin
Of course,
the population? No?
because we can't use the jail for other purposes,
Or you
right?
can violate parole, one or the other,
That he can't do.
you know?
No,
Okay.
which is a good thing because he's not on.
Okay.
So, you know, I have to say that. I'd be remiss not to say that. Okay, are there any questions?
Are the hires that you made today reflected in the April numbers, or will they be reflected in the May numbers? So you're you're making some headway on your hires. Congratulations.
Yeah, I'm almost at capacity.
That's wonderful.
Yes.
From an average of 10 most of last
Oh my
year.
God.
Right.
Yeah.
That's great. Area it was, yeah.
Very good.
Any questions for the commissioner?
Thanks, everybody.
Just a thank you.
Apologize for my stupid question about being readmitted into jail.
That's a good question. But I'm not done bringing up the jail. Alternate purpose.
All right, Humboldt County Youth.
So next Thursday, the 23rd, we are pretty much all set. We have everything in place. The committee has chosen the two winners of the folks that were nominated. Everything's in place. We're expecting like 140 people. So it sounds like we're gonna have a full house. Everyone's excited, and I'm looking forward to it since it's my first go at it. I want to make sure that it comes off smooth.
I'll have 160 there next year.
It's possible.
Hold on, I'm paid for it.
Yeah, that's right. Yeah, I mean, we do have three awesome sponsors between Spark, BSS, and Erica's Insurance, so everything's paid for. So it's been pretty good. I just want to bring up a couple of things, because I haven't got the contracts down to yet for this year, because the state has not signed the rapid and the treasurer has signed yet. There's been like different folks moving in positions, so they're kind of backed up a little bit there. And I do have Germantown for July 6th, Canaan for June 15th. I have one more date open if a town wants to take advantage of the circus this coming year.
September 29th.
September 29th. So, okay,
Yeah.
I'll make sure that September 29th. And Bob and I are actually headed over now. If anybody wants to box, we're headed over to the boxing program.
Left my gloves at home.
I'll pass.
I was just gonna say the same thing, Brandon, yeah.
I never, we just took it out.
Girls with the ball.
Any questions?
So excited.
Yeah, I think we have,
Huh?
I know it's a conflict with, there's another event that day, but we have like 6 supervisors that we're gonna be able to attend, so that's good.
I think you may have 7.
Okay.
Somebody forgot to ask.
I don't get a sectional game, umpire.
Just let us know, we'll have space for you. And Tim and Christine Grossman are doing the buffet.
Excellent.
It's
yeah.
nice.
A happy man, look at him.
Very good.
Yeah.
Yeah.
He's excited. Happy.
Yes, all right, okay.
All right, thank you, sir.
Thank you, sir.
Somebody has been.
Last but not least, Director Almasi.
We might get out of here on time. Good evening, everybody. Good evening. Just a few resolutions this evening. 2 financial resolutions. The first of which, actually both of which have to do with the opioid abatement funds that came directly to the LGU. You may remember we issued an RFP with the county's help, of course. We've had 2 providers respond, so those are the resolutions that you see here. The first one has to do with People USA, a non-for-profit peer-based that is based out of Dutchess County, but wants to come to Columbia County and provide harm reduction, overall opioid awareness services, and would like to partner with existing services that are being provided through entities like the Columbia Green Addiction Coalition and possibly even the Department of Human Services in relation to an initiative that we're considering taking on. So I ask for your support in regard to this resolution.
They were the
Further
ones that were
discussion?
Initially gonna do the, I'm sorry.
No, go right ahead.
Yeah, they were the ones that were initially gonna go over by industrial.
Yes, for the detoxification center, the regional detoxification center. Yes, I believe I mentioned that here before. That concept has been abandoned by Oasis. They withdrew it from here and they never relaunched it elsewhere, which is unfortunate. I've never gotten a straight answer as to why. Because, okay, if it's not going to be here, let it benefit some other region, but that is not how it played out.
Yeah, we had a huge public hearing and they were very well received.
Okay. Second resolution.
All in favor?
Sorry.
Aye.
Opposed, carried.
Second, financial resolution, similarly, in response to the RFP, Columbia County Pathways to Recovery, is seeking, support, from the funds to bolster their recovery center. We only have one recovery center in Columbia County. They are it, and they are struggling to cover their rent. They moved locations, I believe it was a year or two ago. We helped them at that time cover the difference. They're asking that we continue to help subsidize the rent, which I think is important to keep them alive and thriving. And then they also want to bring in a person, I forget what the title is, assistant director, something of that sort, because it's all staffed by volunteers. So they want to bring in somebody that can help them pursue grant opportunities, not necessarily complete the grant application, but identify them and then bring them to the folks that have already come forward offering their assistance to complete the grant application so that, again, they can encumber some income of sorts and do more. Yes.
You're probably not gonna,
Lori Antonson and Frank Martian.
you're probably not gonna find anything less expensive either, so.
No, fortunately. So
No, that's a good space for those who haven't
Yeah, it
been
is.
there, so.
Yeah.
All right, all in favor?
Aye.
Opposed, carried.
So next we have a few personnel resolutions, the first of which is regard to a community mental health nurse.
I'll move that.
Second. Thank you.
All in favor?
Aye.
Opposed, carried.
Second resolution has to do with the behavioral health care coordinator who resigned.
Second.
Further discussion, all in favor? Opposed, carried.
Thank you. And the last one is to, backfill a budgeted vacant administrative assistant. Maria Lull is leaving, relocating.
I'll
So
move that.
second.
Further discussion, all in favor?
Aye.
Opposed, carried.
General resolutions, we have a total of 4 of them. The first one is to contract with a gentleman named Daniel Weinberger. He approached me in my capacity as Director of Community Services, offering his services as a licensed acupuncturist, particularly for ear acupuncture. There's a fancier name for it. I'm not going to attempt to recall it. But there are 5 points in the ear which are particularly helpful for those that have substance use disorder issues as well as mental health issues. So I put him in touch with the various providers, but I talked to the staff at the Department of Human Services who are running groups, and we're going to try and piggyback him on the tail end of the group so that if the group members want to stay on for the 45 minutes/hour to receive the acupuncture needles, they would be welcome to do so. So we're asking to contract with him for a fee of $70 an hour, which is a very reasonable fee.
I'll move it.
Thank you.
Do I have a second? Second. Does he work on electeds?
I think he'd work on anybody.
All in favor? Aye. Opposed, carried.
So this next general resolution is a backup of sorts to the one that you just approved regarding the community mental health nurse. So the current grade is not market competitive. The current grade in the civil service title comes in at, I think it's $76,000 annually. We've talked about this before. That's not a competitive salary for a registered nurse with, in this case, the job description requires a minimum of 4 years experience post-graduation. So we'd be hard pressed. So as a result, I'm asking for your support for this resolution to consult if I can get UPSCU's cooperation. I spoke with UPSCU on Monday, yesterday, and they didn't say no, but they said they would think about it. We discussed other options, which I will be looking into. But just in case I'm not able to attract a community mental health nurse through the civil service position, I'd like to have this in my pocket to pursue in an expedited sort of way.
What are you looking to bring it up to?
I have to do a query so that I can better understand, but I'm hearing through the rumor mill that right around six figures or slightly under is what graduates are getting straight out of school to work as in hospitals. Now, again, this position doesn't bring with it that level of intensity as being a floor nurse, but nevertheless, you know,
It's experience.
we need to attract somebody with a behavioral health background, ideally. So, you know, the 76 may cut it. One of the ideas that I have is to bring a request to the Civil Service Commission to eliminate the 4 years of experience. But, you know,
Your meeting
I'm gonna
on
get
the
a new-
14th. Oh, that's today.
today, yes, I missed
sorry.
it, but it would be for the upcoming month. You know, that's a trade-off, because the way I see it is it might bring me a candidate straight out of school who's interested, but will they stay with us? Will they have longevity with us? Not likely. They would work, get some experience, move on for a position that garners them a higher wage. So it would be a short-term solution. To be honest with you, we are strategizing internally as to when would be the best time to come to county leadership to talk about increasing the grades for several titles. You have this title, you have the nurse practitioner title, and the psychiatrist title, which just are no longer competitive. The market has been astronomical in terms of how it's accelerated. And with regard to nurse practitioner and psychiatrist, we don't even have grades that would go that high. We would have to go beyond, I don't know off the top of my head what the highest grade is, but salary associated with it is nowhere near what it would take. So
CMH upgraded any of those? I know they're not the same titles because they're not civil service, but
right.
in terms of where is their market in terms of?
I don't know is the short answer. I can certainly reach out to them to see what's going
We
on.
might be closer to them.
I know what my colleagues who run clinics throughout the state are offering their nurse practitioners and psychiatrists. And with regard to psychiatry, we're right there. It's between $225 and $250 an hour. It's startling. Nurse practitioners are in the $100 to $125, even in some cases, $140 an hour.
Do I have a motion?
I gotta think about it.
This is to contract for nursing services.
Should we be unsuccessful, and should I garner the support of UPSCU?
I don't
Those are
know what else we can do. Like,
Oh,
if
I
we
do have a
can't hire-
question in terms of upson. Is HR involved in those conversations?
Not yet. The way,
Because they're our point of contact with
Yeah.
them.
I just
right. So the way that this, I brought this to to the representative, Mr. Kutsky, yesterday on the heels of our labor management conversation, just to see if he would entertain it. Again, like I said, I'm pursuing other options before this, but I have one registered nurse and one LPN after this contractual relationship ends, with the former county employee that was the nurse that went to 21 hours as a contracted entity. He's now leaving for good. So, you know, there's an urgency here to get some relief for the remaining RN and LPN. I'm feeling that pressure, which is why I'm willing to, you know, reduce the minimum qualifications, go to Civil Service Commission. There are other options that I could entertain. It could be to, yes, work with civil service, work with HR to increase the grade of the current title. But then I would have to offer that to the existing RN.
Did I misunderstand? I thought this was only about outsourcing the position if we can't fill it ourselves. Is that what this is?
Correct.
Okay.
Yeah.
Yes.
But what I'm in terms of HR, usually it's a negotiation,
Mhm.
whether they allow someone to be hired
Correct.
outside of the FC. So they need to, they're our point person in that negotiation.
So could we approve this subject to Michael's conversation with the union?
But the rate again is to be determined. We don't know what we're approving, correct?
That would come back once you identified the person, right? Wouldn't you?
Correct.
We're not approving that today. We're not approving an individual or a rate today,
No.
just the concept.
Correct. And to your point, Chairman, I was simply, because if Mr. Kutsky had come back and said, Dan, absolutely not. We've already given you a pass on psychiatrists. We've given you a pass on nurse practitioners. This is not something we can entertain. You know, I would, okay, that's where I stand. Because it was a maybe, next step is to talk to Michael Reardon and say, hey, you know, well, the next step is to see how the advertisement for the county nursing position plays out. It's only been running for a week, but I'm just being honest with you that I'd be thrilled if the current advertisement and salary attracted a candidate. I'm concerned that it will not.
But historically, we've done this 3 or 4 times for you, and historically, your instincts have proven right. So I think
Thank
this is just having an option open to us in the event that the options that you're operating under now don't.
And I understand if you'd like me to pause and go through HR, that's fine.
No, I just want to make, because
Caveat.
again, it could be a negotiation where they give up something and we give up something.
Yeah.
That's the way it usually works.
I was on the, upstate the committee, so.
So are you comfortable approving it with the caveat that
Yes.
Michael has the conversation?
I'll make that motion.
Okay.
I'll
Speak to
second.
it tomorrow.
I'll second.
Further
Thank you.
discussion? All in favor? Aye.
Aye.
All right.
Opposed?
Appreciate
Carried.
talking that through with me. Thank you.
Thanks, Karen.
Okay, where did we leave off? General resolution number 3. Yes, this one's easier. Letter of agreement basically between the Department of Human Services and Four Winds. They out of the blue sent me a letter notifying me that our prior letter of agreement had expired. Didn't even know we had one. Don't even really understand why we need one. But since they're asking, I ask for your support to continue this letter of agreement.
second.
It's not like they're guaranteeing us beds or anything like that.
I'm sorry, I don't know what it does. I don't know. what correlations are.
Sure, I'll explain.
All right, I had a motion and a second, but let's
Let
hear.
me answer the question
Yep.
from Supervisor Adams. Four Winds is a psychiatric hospital for adults and children. They have various locations. The 2 locations that we use primarily are Saratoga and Katona, north and south of us. So this is just an understanding between, our 2 entities that we're going to work collaboratively to the best of our abilities. But there's no real teeth to it, which is what's strange to me. So, okay, if it makes them feel better, yeah. We'll
Well,
do
I'm
this
just
for them.
wondering if it's we give our residents a priority in the event that there are no empty beds. No, so it doesn't,
No, they would never do that.
okay, so there's nothing,
It's
nothing in
New
it
York
for
State
us,
Department
right,
of Health
that way.
requirements. When I was the administrator across America, these are things that you have to have letters of agreement between, other facilities just for
Okay,
whatever. It's
so
not even
that's
for the
news to
purpose
me.
of evacuation.
So
Some of
DOH
them are-
requires that.
Yeah, they, don't call me, but that's what I'm thinking because of all the letters of agreement that I had to
Yeah,
do with other people.
That's helpful. Thank you.
So,
I didn't bother to reach out to them to say, hey, why do you?
and I don't know if
this?
it's because of county to county service, payment services. I'm not sure exactly what it is anymore, but I do remember to have letters.
Did we have a motion in a second?
Yes, we did. All in favor?
Aye.
Opposed? Carried. I know if I mess up, I got the ace up the sleeve right here.
Somebody's keeping score. All right, so here we go. Last one. This one's really simple. I ask for your support to contract with CDPHP, a prominent insurance company that serves this area. We had a string of phone calls with them where we renegotiated the reimbursement rate for our behavioral health services. So I'm happy to report to you that we were successful in basically breaking even when it comes to the cost of our licensed clinical social workers and our licensed master's level social workers. Prior to that, it was ridiculously below that point. So we went in aggressive. We wanted the Medicaid rate. We wanted parity. which is being talked about and came through in the governor's budget. So we'll see what they have to say about that. But what we got was, we're covering our costs at least, so we're not losing money
I'll
technically.
move it.
And if the individual pays their copay, we might be making a smidge. But this way, we're at least, dead even.
Good thing.
Thank you, yes.
Can I have a second?
You did.
Okay, all in favor?
Aye.
Opposed? Carried. And that was initially going into the schools, right? Or was this a general negotiation with CDP?
This is general, not related to the schools.
Okay.
That's it, other than the overtime report, which, as you see, started with a balance of 12,000. Just a little over $1,100 into it, leaving us with a balance of $10,841.95.
10% more months. 10% more months.
Yes, yes, we're very conservative.
Well, and we have to see it anywhere, we'd like to see it with the therapist, that's a good place to see it.
Yeah, they do, generate comp time, compensatory time through the after-hours on-call system that's set up, which is helpful for the new employees to generate some time off for themselves, given that the vacation doesn't kick in. So there's an opportunity there.
Perfect.
All right, any further questions for Director Almasi?
Thank you, Jan.
Thank you, sir.
Thank you.
Appreciate it. I appreciate you guys. I know it's been a few months actually since I've given a report. I'll be bringing that with me next time around for June. So thank you for your understanding. Thank you, sir.
Okay, anything from the committee members? Any questions or comments from the public? There being none, I'm going to ask for a motion to adjourn.
So moved. Second.
Second, all in favor? Aye. Have a great day, everyone.